Good morning, everyone. I can report 13 new cases overnight, 8 linked as close household contacts, and the remaining cases are under early investigation. 5 of the 13 were in quarantine during their entire infectious period, and so 8 have spent part of their infectious period in the community. In good news, the number in hospital has dropped to 7, and there is 1 person in intensive care requiring ventilation. Yesterday, 3,311 tests were conducted, so thank you to everyone who came forward for testing. This continues to give ACT Health a very good level of surveillance on where the virus is at in our community. Yesterday was another strong day for vaccination. Over 4,000 doses were administered in ACT government clinics. Now, 61% of those were first doses and 39% second doses, reflecting the pattern of vaccination at this time. Today, we will reach 75% of the population aged 12 and over with at least 1 dose of a vaccine. This number will continue to grow in the coming weeks, with around 70,000 people still waiting on a first dose through an ACT government clinic, and there will be tens of thousands more who will receive their first dose through a primary healthcare provider, either a GP or a pharmacist. Soon, though, we will have administered first doses to everyone who wants one. And then the balance of the vaccination program will shift to second doses, and it will significantly pick up pace. More than half of the ACT population aged 12 and above have now received 2 doses of a COVID vaccine. That is around 185,000 Canberrans. From Monday of next week, the ACT government will start taking bookings in our mass vaccination clinics for 12 to 15-year-olds. Bookings are also available for 12 to 15-year-olds through GPs and will be through pharmacists when the Moderna vaccine arrives. Now, as outlined in the ACT's path forward yesterday, vaccination is the main pathway to move safely beyond our current situation. When the nation moves forward with the national plan and crosses the 70% vaccination threshold in mid to late October and the 80% vaccination threshold in early to mid-November, the ACT's vaccination program will put our city in a very strong position to gradually reopen. We will support the work that is being undertaken nationally and locally to achieve a COVID normal life as soon as is possible. We will continue to contribute to the work of the National Cabinet, and this includes work, detailed work in this Friday's meeting that will focus on the health system capacity, locally, regionally in New South Wales and across the nation, on public health responses, test, trace, isolate and quarantine, TTIQ, and what that will look like through the 70, 80 and beyond vaccination thresholds, and the public health social measures, the public health restrictions, including how these relate to the national plan and crossing those 70 and 80% thresholds. Now, whilst COVID continues to circulate in our community and continues to circulate in communities just across the border, and we are in the process of increasing our community's vaccination coverage, restrictions need to remain in place. What we are looking to do, though, is to get as many people back to work as soon as we can. We are aware of the impacts on mental health of ongoing restrictions, and we will also be supporting mental health measures and prioritising, as restrictions ease, safe outdoor activity. Given our high levels of vaccination and the speed of our anticipated movement between 70% fully vaccinated and 80% fully vaccinated, we do not anticipate needing proof of vaccination to access public or private services in the ACT. We will move through phases of the national plan to transition Australia's national COVID-19 response. Movement through each phase is triggered when the average vaccination rates across the nation, as well as in the ACT, have reached the required thresholds. As I mentioned earlier, this is anticipated to occur in mid to late October and early to mid-November for the 70% and 80% thresholds respectively.